Hey guys, it's Matt from 5 Dog Physiotherapy and Sports Injury Centre. Welcome to this little live video. If you are watching, please press like below or comment hey so that I know that you're there. Now, today we're talking about a really interesting topic. It is the syndesmosis. And what is the syndesmosis? Now, most, I guess, people would have never really heard of this term, and effectively it's talking about a high ankle sprain, which is probably a little bit more common, and you probably hear this more around the footy fields and whatnot. Now, a high ankle sprain is a really, really important kind of injury. It's really critical that it's diagnosed correctly because of the management of it, and it's really important as if it's misdiagnosed and mismanaged, it can be kind of a little bit more catastrophic than a little lateral ligament sprain, which you'd see more commonly. So in terms of the anatomy, if I just hold up this little picture here, you can see there is your fibula, so one of the shin bones, and your big tibia. The syndesmosis is these ligaments in through here, basically when the two bones are split apart. That's a syndesmosis sprain. So there's a few different ligaments that are involved. There's the anterior inferior tibiofibular ligament. There's also one at the back, posterior inferior tibiofibular ligament. There's the interosseous ligament, and there's also the transverse tibiofibular ligament. These can all be a part of this injury depending on the severity of it. Now, the way that it occurs is it can often occur with a hyperdorsiflexion injury. So people, their foot will come back towards their head too much, and that can cause that splitting effect that we were talking about. It can also be a result of an external rotation force, or very, very commonly, it can be a result of a combination of these things with a real big downward pressure. So body weight kind of landing on a foot that's turned outwards somewhat. Now, as I kind of mentioned earlier, it's really, really critical that these are diagnosed correctly and managed accordingly. Sometimes, if it's unstable, it does require surgery, and it can be quite a big thing. Otherwise, it is definitely managed differently to a normal lateral ligament sprain, so just hurting the ligaments on the outside of your foot, in that you'll often require a boot or a brace in order to keep mobile, and there'll be a period where you might be not weight bearing. If it isn't diagnosed correctly and it isn't managed correctly, it can actually be a little bit catastrophic in that it increases the risk of arthritis later in life. It can make you have an unstable ankle. Generally, these kinds of injuries take longer to recover anyway. So it's really important that a physio's had a look at it and really diagnosed and gotten the right investigations to make sure that you do or don't have this injury, and then managed the injury correctly. Now, if you sprained your ankle, I guess the importance in this is most ankle sprains, I think people sometimes just think, you know what, I sprained my ankle, it's all good. Sometimes it's not all good, and it can be quite a problem, and the delayed diagnosis can also be quite a problem. So if you hurt your ankle at footy on the weekend, or netball or hockey, and you've experienced pain, and maybe it feels a little bit higher, or maybe it's not, it's really, really critical that a physio assesses it, and we're more than happy to assess it. If you're watching there, just shout out hey below, or give us a thumbs up so we know you're there. If you have injured it, it's really important that we do assess it and diagnose it correctly, get the right investigation so that we can help your management and ideally get you back on the park as soon as possible. Really, really important. Otherwise, it can lead to arthritis and certainly a really poor long-term prognosis. So it might take you a lot longer to get back to whatever it is that you love, and sometimes people don't get back to what they love. If you want some more information on syndesmosis injuries, please follow the links. We've actually got a blog on this topic, so I can't think of the name of the blog. I think it says something like, is it a simple ankle sprain or not, or something along those lines. So click on the links and you can read all about a syndesmosis injury. If you do need an appointment, please give us a call in the clinic on 97132455. If you are watching, love for you to like this, share this video, or make a comment below. It's Matt from 5 Dog Physiotherapy and Sports Injury Centre. I hope you've really enjoyed this content. Thanks, guys.